Hi, Shai. Lindsay.
Hello, Dr. Koplowitz. How are you?
Good. By the way, I just found out 5,000 people signed up for Nostos. Lindsay.
Hello, Dr. Koplowitz. How are you?
You hear me? By the way, I just found out 5,000
something's
wrong signed up for
Nostos. Yeah. We're also live streaming here, so let me get the volume on that. By the way, we have 263, 67. We have everyone joining. So we're gonna wait for a couple more minutes just to have
Sure.
Dr. Beal and Dr. Leibovitz join us as well.
Is the sound better now? It's not echoing?
No, it was echoing because we're also live streaming on YouTube in case we run out of the Zoom capacity here.
So Shai, I told you about that conference in Athens, and I told you how to sign up for it. 5,000 people have signed up.
Amazing.
I don't think 5,000 people will show up, but they have 100 presenters, including President Obama.
That's incredible.
And the world famous child psychiatrist, Harold Koplowitz. Hi, Ellie. How are you?
Hi. How are you?
It's been a long time. I haven't seen you forever. And now you have a beard. I don't remember you having a beard.
I always had a beard.
Okay, then it's the gray hair. I don't remember.
That's what it is.
You're not supposed to comment on that.
Ellie's much younger than me. It's perfectly okay. You know, it's like,
that's okay.
But his beard is still, but his beard is still black, so it's okay.
You see, it's starting to catch up, but it's taking its time. So in the meantime, I still get kids asking me why my hair is the wrong color.
Oh, I like that. Why is your hair the wrong color? See, I can remember when people would say to me, "You can't be the chief. You're too young to be the chief." That hasn't happened for over 10 years. For over 10 years,
now you miss it.
No one questions that I'm the chief. You know.
Got it.
Good. All right. Message Dr. Beal. He's having his usual Zoom challenges.
So Ellie, the last time I'm trying to think, the last time you were here, maybe it was 10 years ago or so at the Child Mind Institute. So
we did something we had something online. It's been a long time since I was there.
That you were present. Yes, I remember walking up the stairs with you. So we now have almost 310 employees.
Oh wow.
We have 47,000 square feet, but we're moving to new space in January with 81,000, and we'll have 350 employees. And our budget went from 35 million or 38 million in pre-COVID to $150 million a year now. So it's staggering. We have training programs in Greece and soon in Brazil and in South Africa. Donald Cohen would be so impressed. And also we have offices in San Mateo.
That's amazing. You know, I have a postdoc who just kind of finished working with me, and he took a job, but he might be open to possibilities if you're looking to hire. He's like if you're expanding with your personnel.
Yes, no, we are always looking for really great people. So
yeah, he's actually really good. And
is he in New York or is he in California?
Well, so he worked with me here in Connecticut, and I think he did accept a play in New York. So he would be East Coast, but
you should definitely have us call him.
All right, I'll make an introduction. We'll see if he's
guys.
We're live.
Oh, we're live. Okay, great. So Dr. Leibovitz and I are just catching up. Who knew? I'm sorry.
This is like when you went on the Dax Shepard podcast and it just started recording you as you were talking.
That's it. Yes, just Matt Beal reminds me of Dax Shepard. He's just as handsome as Dax Shepard. So
yeah, more charismatic though.
And certainly better educated also.
Oh, and
no offense to Dax.
And less stories about how he did a major in anthropology. We don't need to hear that every podcast.
Right.
Okay.
Great to be with everybody. Good afternoon. Dr. Leibovitz, great to meet you. Thanks for joining us. Dr. Koplowitz, Dr. Henderson, great to see you again. Welcome to everybody who's joining us this afternoon. Really glad to welcome parents and teachers and other educators and other people in the lives of young people who are joining us for this latest version of these conversations we've been having over the last 4 or 5 months, bringing together the Child Mind Institute and Fort Health and national and international experts and leaders in kids' mental health to talk about topics that are of great interest to us and of great importance and great relevance to all of us who are taking care of kids at home and at school and in our offices and everywhere else that we spend time. Really glad to welcome everybody. My name is Matt Beal. I'm a child and adolescent psychiatrist. I'm the chief of child psychiatry at Georgetown University Medical Center in Washington, D.C. And I'm also the chief medical officer at Fort Health, which is a virtual telehealth company addressing mental health needs of children, adolescents, and their families, providing care in New York and New Jersey. And really glad to be part of this conversation tonight with this amazing panel talking about anxiety in children. What is it? How do we recognize it? How do we contextualize it? And most importantly, and we couldn't have a better expert to focus on this aspect of anxiety in kids tonight, is what are the roles that parents and other caregivers play in the lives of young people who have anxiety, both in potentially perpetuating symptoms of anxiety and experiences of anxiety, and also in finding paths towards relief and recovery from experiences of anxiety that run far too many kids' lives every day. So really glad to dig into this conversation. As many folks know, anxiety is the most common mental health condition that affects children. Despite the fact that we know that it's so common, it's also probably the most commonly missed diagnosis in young people. It's oftentimes misunderstood or misdiagnosed or missed entirely. Oftentimes treated in ways that aren't particularly helpful or aren't particularly based on evidence, and sometimes can even make symptoms worse. And so having a more nuanced and sophisticated understanding of what anxiety looks like in young people and how we can be helpful is a critical public health topic. So really glad to be digging into it with this panel. I'm going to ask everyone to introduce yourselves and just share a first reflection of your perspective on anxiety in children and adolescents from your experience as clinicians and researchers in the field. So why don't we start with you, Dr. Koplowitz?
I'm Harold Koplowitz. I'm the founding president and medical director of the Child Mind Institute, which is an independent nonprofit dedicated to transforming the lives of children and families who struggle with a mental health or learning disorder. I think the first thing I want to state about anxiety disorders, that like all mental health and learning disorders, they're very real, exceptionally common, and very treatable. And in fact, the American Academy of Pediatrics recently stated that the most common illnesses of childhood and adolescence are not infectious disease, but are mental health disorders. And early intervention can change the trajectory of an anxious child's life. But right now, 80% of all the kids who have an anxiety disorder do not get any treatment. And very often it's because it's an internal disorder. Kids are worried and they keep it in their head, and they're very often embarrassed about their symptoms. And until they show some behavior that is disruptive or disturbing, they go unidentified and untreated. And untreated anxiety disorders can impact every aspect of a child's life, both educationally, socially, and can persist into adulthood. And they're the most, what's really interesting, while they're the most common and the least treated, if you think about the fact that if you have a symptom for 6 months or 2 years, the prognosis on treating that symptom is so much better than you wait until someone has the symptom for 10 years or 15 years. And the average in the United States is parents wait 8 years from the onset of symptoms till the time they go get some help. But parents, and I think when necessary, the right professionals, can make a tremendous difference when a child with a diagnosable anxiety disorder gets the proper diagnosis and gets effective treatment. So I always look forward to these discussions, and I'm delighted that Ellie is here from the Yale Child Study Center to give us, more information also about the research that's being done right now.
It's a great segue to you, Dr. Leibowitz.
Thank you. Well, I'm honored to be here. It's fantastic to be able to talk with all of you on the panel and listening in. I'm Ellie Leibowitz. I'm a psychologist and professor at the Yale Child Study Center, where I direct the Anxiety and Mood Disorders program together with another professor. And I've been interested in this topic of child anxiety for a long time. I think you've made some of the really key points here, the kind of good news, bad news story, which is, right, this doesn't tend to go away on its own, but it actually is highly treatable, right? With the right help, these are problems that can improve. And the prevalence of the problem, where, as you've heard, even in the best of times, these are the most common mental health problems. But also, let's face it, we have not really lived through the best of times over recent years. You know, sometimes I think if you were to get together a panel of lunatic psychologists and ask them to devise a social experiment engineered to increase anxiety rates in kids and parents and adults, they might come up with something similar to the pandemic that we lived through recently. And you know, the instability, the unpredictability, the loss, the disruption of routine, the social isolation, these are all just factors that are like really engineered to increase anxiety. And not surprisingly, what we see is a tremendous increase in anxiety rates, in fact, a doubling of anxiety rates. So you've taken what was the most common mental health problem and essentially doubled the rates. And even though the pandemic itself may have largely receded in most of our lives, we are not seeing those rates go down, even to the very high pre-pandemic rates that we saw before. And I'm really glad that we're focused here on the issue of parents, and we're going to talk a lot about that. But one reason that I'm really enthusiastic about that is that parents really have the ability to be a tremendous support to their child, not just in a comfort, not just in comforting them as they struggle through a difficult thing, but in actually helping them to overcome their anxiety problem. This is a tremendously important thing for parents to hear and to know, is you actually can help your child overcome even a serious and impairing clinically diagnosable anxiety disorder, which is, I think, a really important and also a really hopeful message. The world is just chock full of kids who used to have an anxiety disorder, and they don't today because they got the right kind of help. So we're going to be talking a lot about what parents can be doing, but I'll hand it over.
That's a great introduction, Ellie. Thank you. And so just highlighting some things for us to make sure to come back to. One, how do we know when anxiety is something to worry about? Two, some of the specifics of our lives, both intra-pandemic and now sort of post-pandemic, but with lots of other factors affecting the lives of children and families that influence the prevalence of anxiety. And then three, parents as the key players in helping to construct a path towards recovery from anxiety for kids. So those are great things to come back to. Thank you. Lindsay, please say hello and any reflections you have about anxiety.
Yeah, thanks, Matt. Hi, everyone. My name is Dr. Lindsay Henderson. I'm a child and adolescent psychologist and the clinical director at Fort Health. And I echo my colleagues' sentiments here, excited to talk about this, and want to just emphasize that the goal of these webinars that Fort Health and the Child Mind Institute, along with great guest experts like Dr. Leibowitz, we're doing this monthly on really important topics. And the goal here is to make the overwhelming part of raising a child or contributing to the healthy emotional development of a child in your community feels like a very overwhelming and intangible and sometimes impossible task. And our goal here is to make this tangible, make this encouraging, make this action-oriented, because there are lots of little things that any of us can do to make a real difference. And I feel that, especially with anxiety, so often mental wellness can feel kind of mysterious and really hard to understand. And anxiety is actually very teachable for any of us, not just, Dr. Leibowitz here, right? They're true expert, but for any of us can understand where anxiety originates, the purpose it serves, and the ways in which we get into cycles where we inadvertently encourage it and what we can do differently. So, little tidbits can make a huge difference. And this is actually one of the most sort of learnable topics that I think we can cover as mental health professionals. So thanks.
Thanks so much, Lindsay. So let's get into it. Dr. Lewis, I'm going to come back to you and just help us get out of the everyday language of anxiety. Anxiety is a ubiquitous human experience. We all feel anxious sometimes. It's normal. It helps preserve our species. There's a reason that evolutionarily we all can feel anxious, and yet some kinds of anxiety are not adaptive. They're not helpful. Can you help us understand what the differences are cognitively, emotionally? What role behaviors like avoidance play in anxiety disorders in young people?
Sure. Well, I think you said it just right, which is, of course, we're all going to be anxious some of the time. Anxiety is not a disease, right? Like it is a normal, healthy part of what we are kind of designed to experience. But like any system, it can also get hijacked by a disorder that kind of makes it run wild. And that's when you start running into problems. And, if you were to leaf your way through the DSM, that Merck manual of psychiatry, where you have all the mental health conditions, you'd see lots of anxiety disorders. You'd see social anxiety, where kids are really impaired in their ability to just function socially and so preoccupied with other people judging them all the time. You'd have separation anxiety. Kids are just terrified of being away from their parent and so worried about what's going to happen to them, what's going to happen to the parent when they're not around. Or you'd have endless phobias, right? Like your specific phobia of storms, of the dark, of heights, of animals. You'd have generalized anxiety, which is a kind of interfering worry that just persists and churns away in your mind, robbing you of all those other opportunities that you might have to just relax and recharge your batteries a little bit, and on and on. These are how we diagnose these disorders, but really, these are not really separate conditions. They're all separate diagnoses, but they're not really separate conditions, because underlying that, what an anxiety disorder really looks like is excessive worry, excessive fear, and excessive avoidance of various situations and circumstances or things and objects that trigger your fear. So if you have social anxiety, that trigger for you is the social judgment of other people, and you're going to avoid all those situations where you might find yourself feeling judged. And if the trigger for you is that separation, then that's what you're going to avoid. What you're going to see is that kind of persistent preoccupation and the avoidance. It's going to impact your thinking, because you tend to get really stuck on just worrying about whatever it is. And people sometimes say, it's like my kid doesn't want to stop worrying about it. Well, it's not that they don't want to stop worrying about it. It's that when you're freaking out, somebody telling you don't worry about it doesn't really sound like helpful advice. It doesn't sound like something you could do. And so your mind really gets stuck in those patterns. You avoid the things, which means you really don't get to practice them at all, and maybe learn that you could handle some of those things. And I think you start to see disruption in so many aspects of your life, whether that's your ability to function in school, right? Like to go to school, to achieve there, to interact with others, your ability to function socially, have friends, talk to people. Your family relationships start getting strained and difficult, and your own personal life. Just how can you go to sleep at night? How's your appetite? Do you have belly aches and backaches and headaches all the time? Are you nauseous so much of the time? The more we see these kinds of things adding up, the more we're going to start thinking this is an anxiety disorder, as opposed to just some of the normal stress and anxiety that everybody is going to go through some of the time. So, if it's really interfering with your ability to function in those different domains, and it's been going on for a while, that's probably when we're going to start thinking about that as an anxiety disorder.
Perfect. Thank you. That's such a comprehensive and helpful response. And it makes me think of, Lindsay, I know that, we're colleagues and friends, and I know that in addition to a psychologist, you're a parent. And just, thinking about what are the reactions that any parent has? The first reaction, maybe the first, second, and third reactions that any parent has when you see your child struggling with feelings of anxiety. What are the things that come up for a parent?
Yeah, of course. I mean, our jobs as parents is to love this little being and do everything we need to do to take care of them and to, protect them. And so that is a very difficult instinct for parents to adjust and accommodate and evolve as their children grow older. So when I have seen my children anxious, your heart breaks first, right? That is a very normal response. That is a very understandable and predictable reaction. And we want to jump in and we want to fix it. And so that is the first challenge. Number one is being able to kind of tolerate the urge to solve the problem at an age appropriate way as the first step, as the first instinct. Because when your child is an infant, you do need to solve the problem right away. When your child is in first grade, like mine is, I need to take a breath and figure out the best way to support that solving. When my child's 18, I'm really going to need to take a breath and figure out the next phase of solving or supporting that problem solving and tolerating the big feelings that come up. So, that gets even harder if you are a parent who struggles with your own anxiety. So there's nothing more anxiety provoking than seeing your child worried or anxious or struggling. We can feel helpless. That's a very normal response. And then I also want to call out that it is a very normal response to feel frustrated and even to the point of feeling some anger come up when you see your child just not be able to get out of their own way, not be able to let go of what seems like a silly or a solvable problem. That whole range is very normal. And I can say for myself that I've experienced all of them. Matt, Harold, and Dr. Leibowitz, we just met, but I bet you guys all have as well or can relate to some extent.
Yeah, that's beautiful, Lindsay. Thank you. I know I can. And you made a really important point that I think we'll come back to, which is that not all anxiety in our kids or in ourselves looks like trembling with fear. It can look like frustration. It can look like irritability. It can look like being overwhelmed. It can look like shutting down. It can take a lot of different forms. Harold, I'm wondering, as your sort of perspective on the field and on kids' health, what are you seeing big picture in the numbers about how anxiety disorders are changing in terms of how common they are? And then in a related way, what are some of the social trends that you're noticing are influencing the prevalence of anxiety in kids? Dr. Leibowitz mentioned the pandemic, of course. I know last week, the Surgeon General's notice about social media came out. Help us to tie together some of the big picture trends socially and culturally around anxiety.
Well, first, a trend we've known about for quite a long time and continue to see is that adolescent girls are about twice as likely to have an anxiety disorder than boys. And we know that a recent CDC report that teen girls are struggling. 57% of US girls have reported that they felt persistently sad or hopeless in 2021, and that 1 in 3 teenage girls in the United States had considered attempting suicide, which is almost a 60% increase from a decade before. So what Ellie was talking about, could we create an anxiety-provoking environment, which, frankly, if someone handed me the script of the pandemic, I would say I reject this movie. It's just too overwhelming. We're not going to do this movie. It is really telling that while the suicide rate for teenagers went up from 2014 to 2018, pre-pandemic, from 5,000 to 6,120. And the number of kids who went to emergency rooms went for suicidal behavior, suicidal ideation, went from 600,000 to 1.2 million. And the only thing that changed in those 4 years was social media. We should talk about that just briefly, because I think the Surgeon General's report advisory is very important. But since that time, since 2018 to now 2023, as Ellie said, we've seen a doubling of the number of kids who are struggling with anxiety and also depressive symptoms. But I think the thing we should talk about with social media, in 2011, something really changed in our world, because our brains have evolved to know a small group of people, but know them very well. And then 2011 comes, and we are connected to every human on the planet, and they're available to us 24/7. And that is exciting and incredibly frightening. And we basically take our kids and they're thrown into this jungle, which has some good stuff and has some incredibly scary and dangerous stuff, which really means that parents have to be alerted to this, because if you spend too much time in the jungle or online, you're less likely to sleep, you're less likely to have real life interactions, and you're less likely to really, and most importantly, I think, pay attention and stay focused and exercise. And all those things are really important for childhood brain development. So I think that we know that certain kids are going to be more susceptible to problematic internet usage, the kids who use and participate in social media, but also in even streaming and gaming, which are very addictive. These things are going to have a particularly more stressful and more toxic effect on kids who struggle with a mental health disorder. So, all of these things are coming together in a negative way. So we've had social isolation and a breakdown of our society, which is so frightening to kids that they didn't go to school, or they didn't have to go to school, and their parents got sick. And we know that 170,000 American children lost a parent during COVID, or a caregiver. So on top of that, we then also have the fact that we started using more social media than ever. So there is a definite trend that Ellie pointed out, but that we can see that right now globally, 20% of the kids in the world are struggling with anxiety symptoms. This is
Right.
a real life public health problem.
Right. Absolutely. And so, Ellie, I'd love to come back to you and have you help us to conceptualize anxiety through the lens of a family. And there's some excellent questions already in the Q&A. I'm gonna sort of merge a couple of them. But if you could help us understand relative contributions of genetics, of learned behavior and modeling, and of everyday interactions between parents and kids that help to influence the way that these things may be manifest along some of the trends that Harold's mentioning. And then I promise we're going to get to the good stuff, the stuff that we can do to help.
Well, we know that there is a heritable component to anxiety. We don't really know how much of that heritability is actually genetic transmission as opposed to non-genetic transmission. There's good reasons to believe that both occur. In other words, there's data supporting genetic influences in risk for anxiety. You look at like twin studies and things like that, and you can see there is a genetic component, but actually it's not all genetics. Even when we talk about heritability of anxiety, it's not only genetics. We also know that there are influences like modeling and how you deliver information and what are you teaching and things like that. And so, yeah, there's definitely a family component in that sense, but I think there's a deeper sense in which there is a special family component when we start thinking about anxiety. And Lindsay touched on this before when she was talking about, like, do I jump in and rescue? Do I take a step back, take that deep breath? And for a very long time, actually, we tended in the field, we tended to think about child anxiety as essentially a mini version of adult anxiety. Right? Like basically the same thing, only in a small package. And treatment also tended to be very similar. So, we think about the symptoms and how can we target them? You have maybe distorted thinking, right? Like you have certain cognitive biases. How can we target those through a process often called cognitive restructuring, basically teaching you to think different? Or we think about the symptoms of avoidance. How can we target those through processes like exposure, which is a big part of cognitive behavioral therapy for anxiety, but essentially applying the same model to understanding child anxiety and adult anxiety. And it's all great, but what it misses is the fact that actually child anxiety is not identical to adult anxiety. It's actually not the same. And the reason for that is that children, like all other mammals, are born hardwired with the tendency and the instinct when they are anxious to look to their parents to solve the problem, to look to their parents to protect them, and then also to soothe them once danger has been averted. This is hardwired, deeply coded into the mammalian brain, because mammals are born pretty helpless, right? We're born not really able to protect ourselves. If you expected an infant to defend themselves from threats, you'd be pretty foolish, right? That's not going to work. And so we're born with that tendency. And when you have a child who has a lot of anxiety, right, they're constantly feeling this activation of their fear system, of their threat detection system, what happens is that they're always looking to their parents to rescue them from that, because that's the natural response. And parents get very sucked in to those symptoms, right? They get deeply involved in responding to all of those symptoms. And how they respond really matters. We can talk about this more, but how you respond as a parent to it really matters and can make the difference between a child getting less anxious or a child getting more anxious. And that's really the deeper sense in which anxiety is a family level problem, because we're so naturally inclined when we are small to see our anxiety as a problem for our parent to solve. And parents are also really hardwired to respond to those cues. When my child looks scared, when they're worried, when they come to me with their fear, it's hardwired into me as a parent to want to respond to that. And how I respond really, really matters. I'm going to let others have a chance to talk as well, so I don't monopolize our time. But I want to come back to that because I think it really makes a huge difference how you end up responding to your anxious child. But before I do hand it over, I do want to say one thing, since we're talking so much about parents and probably going to talk more about parents. I just want to make it really explicit that this is not about blaming parents. We as a field, mental health, we've done so much damage over the years, so much damage by blaming parents for their children's mental health problems, right? Mothers cause schizophrenia and autism and everything. And it's all not true. And in fact, it's not true for anxiety either in the huge majority of cases. It's not because you parent like this. What we're saying is you can help your child overcome this problem, not your kid has anxiety because you're too much of this or not enough of something else.
I'm so glad you said that, Ellie, and I think any of us who've had the gift and the privilege to be parents, particularly parents of more than one child, knows how strong the temperamental factors are that children come into the world with, and parenting each child is a totally different challenge. And the idea that parents are causing these symptoms that we see in kids who show up in your office or mine when they're 8 or 10 or 12 is profoundly unhelpful. But what can be much more helpful is helping guide parents through the process of undoing some of the habits that develop within families that I think families develop in order to ideally reduce everybody's distress. And unintentionally, in trying to reduce distress, families can create some really tough situations. So Lindsay, I'm thinking like if, in your clinical practice or when you're working with clinicians that you supervise, you hear about a family who has a 9-year-old child who is really nervous about playing their musical instrument with the band in front of the other kids at school. And so sheepishly, the parent tells you, yeah, I actually have gotten her out early from school before music class for the last 3 weeks in a row. How do you think about that as a clinician, and what kind of feedback do you give to a parent?
Yeah, so I try to bring it back to this narrative or this concept of big feelings or feelings as a superpower. And we all come out with a temperament. As you said, Matt, I think that's a very useful concept to use with parents. And most of us can see it either among our own siblings or with our own children. How do you really normalize and talk about a child's big feelings or their feelings in general from a very early age? So it's not about something being bad or good. It's about just, this is you feel things deeper, longer, and that can be so good. Let's figure out how you're going to control your superpower, how you're going to put it towards good and not evil, whatever kind of metaphor you may want. So the other metaphor that I find helpful is this idea of feeding the anxiety monster or the beast. And so this creating a story with clear images that both parents and kids can understand, that avoidance is really at like the root of the anxiety cycles that get us into really stuck patterns of behavior, that we as parents accommodate the avoidance of the difficult or painful situation. We take away that stress for our child or for ourselves by avoiding whatever the trigger is. And so every time you enable that avoidance or you engage in that avoidance, you are feeding the monster and giving him energy and fuel. And really kind of coming back to a couple of core themes and images that kids and adults can really understand, I think helps to ground us in that teachable science that I mentioned at the beginning. How can we not feed that monster and ride the wave of the big feelings that come up in the process of not avoiding, of facing your fears, of taking the baby steps to make your fear muscle a little bit stronger so that it doesn't feel as big the next time around. So, that's a bunch of concepts, but really like thinking about these core understandable ideas that really can like grasp onto in the moment of distress.
Yeah, thanks so much. Well, let's continue with that, with the conversation about distress. And because I think that there are some key words to use here with kids and families. You talked about, I think some of the courage and bravery that is required to do something that's difficult, to feel afraid and to do it anyway. Being brave isn't not feeling afraid, it's feeling afraid and doing it anyway. Harold, talk about, if you would, about distress and distress tolerance and how that's a muscle that we can build, that our kids can build and that we as parents can build in facing anxiety.
So let me just step back. First of all, Ellie and you are selling an old book of mine, which was called It's Nobody's Fault, New Hope and Help for Difficult Kids and Their Parents. And that stigma of you've done something wrong and that's why your child is not able to go to school or not able to play in the band or afraid to go to Little League because he's going to, strike out, really does persist. And part of that is that I don't think it takes very much for a parent to feel worried or to feel guilty about their child suffering. And in fact, the expression of you're as happy as your least happy child, when your child has that worried look, I took care of a lot of kids who had school phobia and separation anxiety, and mom's driving the kid to school and the kid just has that sad look. The number one thing we used to tell parents is don't ask them what's bothering them, because it's like opening Pandora's box. Oh, I'm worried about this, that, and teaching them how to contain, the worry and to be brave. I think what you said, Matt, is really important. I think that our patients are very often remarkably courageous. And the reason they're remarkably courageous, they get to do things that are easy for others and hard for them. I think we always think of courage of people running on the battlefield and shooting and being shot at. I wonder if that's courage, but going to school every day when you're really worried that something bad will happen to your mom and dad and everyone else is carefree and skipping into school, that shows a tremendous amount of courage. And it may be why very often we see kids who struggle during childhood, whether it was a learning disability or an anxiety disorder, who later on go on to do extraordinary things. And I think it's because they get this formidable courage, this remarkable resilience, because their parents have helped them build that distress tolerance that we're talking about, that, it's a muscle basically of you can do this. And sometimes we'll do it with little steps, exposure, response prevention. You go to school for just the front door. The next day you get to sit in the library. The next day you stay again in the library. Maybe the third day you're in a class for just a few minutes, and building that ability to tolerate the fact that, your parents are not around or that you don't have access to mom and dad. And and there's multiple things that are making life harder for kids. It's not only the pandemic, it's 24/7 media. So that, all of a sudden school shootings, which are still relatively rare events, become very common events if we hear about them almost every day or every other day, because whatever happened in Texas or Minnesota or Washington, D.C. seems to come into our living room. I'm clearly the oldest person on the screen, but I could tell you what turned around the war in Vietnam was the fact that all of a sudden the media was covering the carnage and the death in the jungles of Vietnam. And America just couldn't get over that this was happening to our boys. And that helped turn public opinion. Think about how kids are exposed to climate change. And if you're a worrier to begin with, what's going to happen to the climate, the fact that, so many Black Americans are being shot, that you then had the pandemic, you then hear about the divisiveness of the nation. All of those things are particularly challenging for a kid who's already sensitive. And the good thing about being anxious is that you're sensitive in a good way, but also sensitive in a bad way. And so helping your child recognize that we don't want to change your personality, we just want you to be able to endure some distress and some uncomfortable feelings for some of the time, because you'll get stronger and stronger.
Perfect. Thanks, Harold. That's a really great context. And I'd like to come back to you, Ellie, and ask you to tell us a little bit about the intervention that you and your colleagues have developed that is really an intervention for parents. Tell us about the SPACE program and how it works and what the results are that you're seeing.
Sure. So SPACE, which I should say, I guess one time stands for Supportive Parenting for Anxious Childhood Emotions. What SPACE is really a completely parent-based approach to treating child anxiety and related conditions like obsessive compulsive disorder. And when I say parent-based, what I really mean is two things. One is it's the parents coming to the treatment sessions, which is a big game changer, because getting your kid to go to treatment sessions is not always all that possible, right? Not every child is the ideal candidate for therapy. And anybody who's tried to do therapy with a kid who doesn't want to be there knows it's not always the most fun experience for either party. So in that sense, it's parent-based. But the other sense in which I say parent-based is that the focus in SPACE is actually on changing the parent's behavior. This is actually really different from the way people used to work with parents of anxious kids, which was to give them homework, like you're going to go home and be your child's therapist. You're going to go home, you're going to get them to do exposures, you're going to get them to do. Problem with that is, again, getting your child to do things is often easier said than done. And, when you're a parent and you think you have to make them do something, you sometimes will try to push really hard. Sometimes they're going to push back. You might end up with some conflict. You may end up doing more harm than good by starting down that path. And so that's the other sense in which SPACE is parent-based. It's that the focus is all on changing the parent's behavior. And there are really two changes that we're trying to bring about in parents' behavior. So it's really simple, just two things, but really important things. And those are, one is to be more supportive in response to your child's anxiety. When we talk about support in SPACE, what we're trying to get parents to do is to respond to their child's distress in a way that's showing that child, I get it, like a genuine acceptance of the fact that this is actually hard for you, right? I'm not dismissing it. I'm not saying it's nothing. I get it. It is genuinely hard for you. But I'm combining that with a message of confidence. I believe you can handle some distress. I believe you can cope with some difficulty. The greatest gift that you can give to an anxious child is not an anxiety-free environment, right? If you bend over backward to give them an anxiety-free environment at home, A, you're going to fail. B, even if you succeed, all you'll do is teach them that they can only exist at home, because the rest of the world is never going to be anxiety-free. So all they'll do is think, I can only be okay at home. I can never go outside. The greatest gift you can give them is actually the feeling that I can be uncomfortable sometimes. I can handle some distress sometimes. And those supportive messages are the first of those two big changes that we're trying to bring around. So the acceptance and confidence. I say, if you're listening to this, you walk away with one takeaway from the things that I say, you'll hear more important things from the other panelists. But from the things that I'm saying, if you walk away with one thing, it's the recipe for support. Just put together the acceptance and the confidence. It can sound as simple as saying to your child, I get it. This is really hard for you. And I know that you can handle it, right? So it's not difficult, but just be persistent in that. The second change has to do with what we call accommodations. These are the ways that parents get sucked into the child's anxiety symptom. When we talk about accommodation of anxiety, what we mean is the different ways that a parent is changing their behavior to help the child not be anxious. Maybe that is, I'm talking in place of my socially anxious child. Maybe I'm sleeping next to my child with the separation anxiety, or picking them up early from the school because the recital is hard or the test is stressful. Maybe I'm just answering endless worried questions, right? Like just constantly reassuring my child because they're so worried. They're all examples. Sometimes it's things I'm not doing. Maybe I don't have the news on because I know it's going to trigger my child's anxiety. Maybe I don't go out in the evening because my kid is worried if I'm not there. So it could be things you're doing or things you're not doing, but all of those accommodations, they're well-intentioned and they're ubiquitous. Almost every single parent of an anxious child will be doing some of those accommodations, often many. But what a lot of data show us is that they're actually not helpful, is that as you accommodate more, children tend to get more anxious rather than less anxious. And it takes over family life if you let it. And it can impact siblings too, because maybe accommodating this child sometimes comes at a cost to another child, or just to the parents' own relationship because of all the time that they're putting into the accommodation. And so the other change that we bring about in space is reducing those accommodations. And we don't say just stop all of it. We're saying let's pick one thing, right? So we'll spend time with parents figuring out what are the different ways that you're accommodating and picking one particular place to focus, coming up with some clear plans for how you're going to change that, working on how you're going to let your child know about that change. We don't want to take them by surprise. And then actually putting that into action. And inevitably, space also includes tools for how you're going to cope with your child's response. Because it turns out, to nobody's surprise, that when you start reducing accommodations, children do not always immediately thank you and congratulate you on your deep understanding of child anxiety. Sometimes they get upset. They might get angry. They might get frustrated or worried or distressed. They might say, you don't care about me. These are hard things for a parent to be coping with. And so we also have tools for how we're going to manage that. But when parents are able to make those two changes in a somewhat consistent manner, to be more supportive and less accommodating, children actually do get better. We now have multiple randomized controlled trials supporting the efficacy of this treatment approach. And in fact, what the data actually show is that doing this with parents is as effective as working directly with a child in therapy. It's as effective, which is amazing because your child doesn't even have to come to the therapy sessions. And so it really means we have another evidence-based tool in our toolbox for how we are treating anxiety. And since our time is short, I'll pause there and I'll just say parents who want to learn more about it should, there's a website, which is spacetreatment.net, and you can learn a lot more about the treatment and also find a therapist who's trained in this treatment approach if you go to that website.
I just want to emphasize as a colleague in the field how powerful it's been to have this tool added to our repertoire. I think, and as a parent who's heard myself saying to my own kids many times, some versions of be a big boy, be a big girl, cut it out. Is it really such a big deal? Is it really so hard? All of these fundamentally unsupportive things that we find coming out of our mouths as parents when we're frustrated or overwhelmed by our kids' difficulties, finding ways to rework those is so helpful. And along with your second point around accommodations, the realization that we can come to for how our children have been training us to save them and to rescue them and to help them to avoid the things that they feel are beyond what's possible for them. they've trained us very powerfully, and learning how to undo some of that training and to re-empower ourselves as parents in order to empower our kids is really powerful stuff. So it's such a useful intervention. It's so affirming for those of us that really like to work with parents to know that the work with parents is just as powerful in many cases as work directly with kids. I'd love to ask Harold and Lindsay, ask you both before we get to questions in 2 or 3 minutes. Just talk about at Child Mind Institute and at Fort Health, what are you and your teams doing to help families understand does their child need clinical help, and then what kind of clinical help is available?
So I think there's some very good news here, because Ellie's talking about an evidence-based treatment. That means something that's studied and looked at compared to either placebo or some just being supportive. And so we do know that anxiety disorders are sometimes the most treatable, so that if you look at a study that uses cognitive behavioral therapy, which is the way we think affects the way we feel, which affects the way we behave, and you do 12 weeks of cognitive behavioral therapy along with an SSRI, a Prozac-like drug, 81% of the kids get better. Think about that, 12 weeks, and I don't think there's anything else in medicine that would get that kind of remarkable response. So the news for parents is that if your kid has an anxiety disorder, and the way we start thinking about this is really going back to distress and dysfunction. Is your kid so uncomfortable and so unhappy that they're also having so much difficulty functioning, whether it's sleep, whether it's their appetite, whether it's the attendance at school, whether it's the participation in extracurricular activities? You as a parent have to know your kid. And over a 2-week period, if your kid's sleep, appetite, joy, school performance has deteriorated because of this kind of avoidance, and then we know it's time to reach out. One of the other things we have at childmind.org on our website is a symptom checker. And I recommend, in the same way that you should go to look at space, you should go to childmind.org and take the symptom checker and see if it pops up that one of the diagnoses or multiple of them seem to be an anxiety disorder. That's a good place to start. One of the things we feel very fortunate in our partnership with Fort Health is that literally it's a phone call away, that, you're able to reach out to Fort Health, if you're in New Jersey, New York, and someone will be available to you and then to your child that provides, again, that evidence-based treatment. I mentioned before, exposure response prevention is one of those types of cognitive behavioral therapy, which is distressful for a child, because if you're afraid of spiders and, you have to look at pictures of spiders, or you have to hold a stuffed spider in your hand, and eventually you have to let a spider in your hand, but that it's building that muscle. You're helping the kid to recognize that avoidance just makes the muscle weaker, or makes the monster that's called anxiety stronger, and that very quickly a child will start to see relief, even though it might not be pleasant. It's not playing with someone. It is actually making every session count, can make a world of difference for these kids.
Thanks so much, Harold. Appreciate it. Lindsay, can you add some perspective around what Fort's doing around anxiety?
Yeah, I want to emphasize that that can be really hard, and that parents deserve like a coach, of someone in their corner to help them along the way, to keep our own gumption up and our own motivation to stick to the plan, because it's in some ways it's harder work for the parent, right, to make some of these changes and tolerate what emerges. And I can say that as a parent myself. I've been through this, and as I'm talking to all of you, I still benefit from going, the resources we make available through Fort Health, through the Child Mind Institute, the psychoeducation on understanding anxiety and how we reinforce inadvertently our child's behavior. I keep coming back to those myself because I need them as a parent and as a child psychologist. So with Harold's website, with our ability to offer education and coaching to parents outside of New York and New Jersey, that, just give yourself a little credit that this is hard work, and you need someone in your corner to keep getting you back on track and to answer the questions that come up, so you can feel empowered and keep going in back there and encourage, and knowing that the little things are making a difference. So, Matt, that's one of the things we're really proud of it for, is just being able to offer that very specific, both the treatment, but also the just psychoeducation, parent support, anywhere outside of New York and New Jersey where we're able to deliver clinical services. So yeah, look for those ways to keep coming back and reinforcing the foundations. I still need it.
Fantastic. Thanks, Lindsay. I'd love to, I'm going to do my best. We've got 80 questions in the Q&A. I'm going to do my best to do a little bit of merging and shaping into some amalgam questions that will, I hope, speak to some of the curiosities and concerns of this great audience. Anyone can take this one. There are a number of questions about the interface between kids on the autism spectrum and anxiety. Maybe Ellie, maybe we start with you. I'm sure this is a very common question for you. How do those two sort of pillars of parent support that you talked about, increasing support, reducing accommodation, how do those change, if at all, and how do you adjust advice you give to parents who may have kids who have both autism and anxiety, which is a tremendously common comorbidity? I think many people who are autism experts would say there are very few cases of autism spectrum without some anxiety present.
Yeah, well, given you have 80 questions, I'm going to try to be brief, but I'll say, first of all, I agree. It's rare to see a kid with autism who does not have some elevated level of anxiety. Good news is we actually just wrapped up the first clinical trial of space specifically for children on the autism, with autism spectrum disorder, basically with autism. And these were children with high functioning autism, and so their intelligence was intact and they were verbal. However, even though this paper is not yet published, it's currently under review, I can say the results were actually very positive, meaning it is possible to do this treatment for parents of children with autism. I think it can take a little bit longer than it does with children without autism, so you might have a few more sessions than you would otherwise. And there are some tricky things like figuring out what is accommodation of anxiety versus what is more related to the core autism symptoms, the repetitive restrictive interests and behaviors that are typical of autism, what is accommodation versus potentially helpful, to borrow a word from Harold, scaffolding. These things can be tricky, so you'd probably want to have some deep expertise in both anxiety and autism, but bottom line, yes, you can do this treatment in autism and it works.
Fantastic, thanks. So, Harold, you mentioned medication treatment for anxiety. Can you help parents think about how to triage a clinical approach when you've decided that your kid probably needs help? What's the first line treatment? When does medication come into play? When do both work well together? There are a number of questions related to medication and anxiety.
So let's start with diagnosis, right? Without diagnosis, you don't have treatment. Treatment is, we're all coughing. We don't all have pneumonia. Someone might have an allergy. Someone might have a virus. Someone has a bacterial infection. They get the antibiotic. So you definitely want diagnosis. And if you know that your kid has an anxiety disorder, the first line of treatment is evidence-based psychosocial treatment. And we feel strongly that if after 4 weeks, there is no relief and your kid is still struggling and feeling bad, persisting in that situation very often can demoralize the child. The kid will, I'm going to see a real good doctor. Everyone's helping me, my mom and dad, and yet I'm still in so much pain. And it's at that moment that I think parents should reach out. And this is where a child and adolescent psychiatrist really makes sense. Pediatricians are super smart. They are not as comfortable using SSRIs. And these medicines, Prozac was the original one in 1986, are really amazingly effective. And very importantly, they're not feel-good medicines. You're not going to teach your child how to use drugs or increase their risk of substance abuse. If anything, you might decrease it, because when kids are really uncomfortable, they want comfort. And marijuana, which is terrible for anxious kids, it's more likely to cause a panic attack, or alcohol, are quick fixes to making you feel less anxious. But an SSRI takes anywhere from 2 to 4 weeks to kick in and start to really give your child's brain more accessibility to serotonin, which is one of the neurochemicals that we need and have available to us in our brain to not feel too rageful, too anxious, too depressed. And these medicines, which were originally established and developed for depression, turn out to be outstanding medicines in low doses for kids with separation anxiety, social anxiety disorder, and in higher doses for kids who have obsessive compulsive disorder. And the rule of thumb is that if you give these kids meds and they get relief, you keep them on the medicines for about 1 year. And while they're getting the medicine, they get the tools that you could get from what Dr. Leibowitz, what Ellie is describing as SPACE, or what I'm describing as cognitive behavioral therapy, the tools for the kids. And then very slowly, you titrate them off the medicine after 1 year. And as you're slowly doing that, if the symptoms don't come back, you're so fortunate that a child's been on medicine for 1 year, has new tools, and we've changed the trajectory of their lives. And if anything, we've mostly decreased the chances of them abusing substances.
Thanks, Harold. I think one of the things that stands out from what you said is that we as parents and as healthcare providers, we have a lot of shots at this. We have many opportunities to try to help kids and families. Ellie, can you weigh in on how you think about parents and caregivers of young kids? I know there's really profound work from Jerome Kagan and lots of other people about how anxiety can oftentimes show up developmentally in kids as young as 18 months or 2 years old, and that can be predictive of anxiety problems that emerge later. What can parents of younger kids do to help to raise the healthiest, most courageous kids?
Well, first of all, yeah, I mean, these things do show up early. Often what you'll see if you go young enough, what you'll often see is what you might think of as the building blocks of a later anxiety disorder, meaning you might not see symptoms that fully match what the DSM would lay out as the criteria for a disorder, but you'll see some of the building blocks that will later be shaped into that. So for example, in a young child, maybe you won't see social phobia because they're not talking about other people judging them, but you might see behavioral inhibition. You might see a child who's less likely to join the group, wander over, get a little bit, curious about what's in the room. Or you might not see separation anxiety technically with a child who's worried about what's going to happen to the parent, but you might see a child who's very clingy, who's reluctant even when the parent is there to sort of go over to the other end of the room and play with some of the toys or things like that. And so temperamentally, you might see these things. And the other thing that you'll often see in younger children that is highly predictive of later anxiety is actually irritability, temper tantrums, anger, things like that. A young child with temper tantrums actually more likely to develop a later anxiety disorder than they are to develop some kind of serious behavior problem that you might be worried about when they look so scary because they're having a temper tantrum when they are young. But it's important to remember anger. I think Lindsay touched on this earlier. Anger is as much a part of the anxious response.
Sure.
It amazes me all the time that so many people, I mean, everybody knows the phrase fight or flight. I think we all know it, but we often forget that half of that is fight. And that means that anxiety primes us for anger. And very often in younger kids, that's what we're going to see. Now, what can parents be doing? I would say to take the same overall approach that we're talking about in the older kids, but translated for a younger child. Help a child to recognize their own feelings. Don't just have your own anger triggered when they're getting upset and just think about the discipline or just think about, laying down the law and putting your foot down. Help them to label their emotions. Now you're feeling this. Maybe you're frustrated. Maybe you're angry. Maybe you're sad. Get a handle on those feelings. Teach them that it's okay to sometimes have those feelings. Model on yourself. I sometimes have these feelings as well. Here's how I handle it. Maybe I'm getting upset with you because you're acting out. I need a minute to go calm down. Then I'm not going to get mad, but I'm also teaching you. Here's a coping skill that you can use as well. You give yourself a little bit of a timeout to feel better, and let them be exposed to some of those harder feelings as well. Just like you want to build up the physical immune system, kind of build up the emotional immune system as well by exposure to some of those negative feelings and not always rushing to defend from them.
That's great. That's a great analogy to close with. And I just want to, before we wrap up, and I appreciate everyone's attention and participation tonight, particularly to our panelists, to just again reshare the resources that have been shared. Dr. Leibowitz's SPACE treatment is at spacetreatment.net. This is shared in the Q&A section. The Child Mind Institute has an enormous wealth of resources for families and children about all things related to children's mental health at childmind.org. Fort Health is a new clinical entity that's providing evidence-based psychotherapy and psychiatry services for children and families virtually in New Jersey and New York at Fort Health. That's Fort, like fortify, forthealth.com. And also is providing training for parents and caregivers by video resources through the Fort Health website as well. Fort Health and Child Mind are close partners in all things related to promoting outstanding care for kids and families, which is why we were so glad to be joined by Dr. Lee Woods today, a real vanguard leader in the field, and super grateful for your participation here tonight, Ellie, and glad to be with you as well, Lindsay and Harold. Thanks so much for doing this with us.
Thank you,
Matt.
Thanks.